With our inaugural fitness/rehab case study. And the purpose of these case studies is to just kind of give you my thought process as to how I work with clients and why I do what I do. And we call it fitness rehab because it really is a continuum between rehabilitation or sort of correction from chronic injury into high level performance or just for and that's relative to every person. We might be working with somebody that's a grandma and she needs to chase her kids, or we might be working with a high level soccer player or golfer. It could be either one of those. But when we work with a client, really we have two components of our business, one being or our session, one being corrective exercise to kind of get the person's body back into neutral and address the injury concerns. And number two being the performance-based training, which is typically going to be strength training or some sort of conditioning to reinforce what we did. Those two things work really well together. Certainly I'm biased, but in my world, this is kind of how things work. So our case study today is going to be a soccer player with a hamstring pull. And this is actually, this is my friend Mike. Mike plays on my soccer team. He came to me about 2 months ago, and throughout I played with him for about 2 years. He's suffered, I wouldn't call them hamstring pulls, but strains throughout the time that I've known him. And he's somebody that has had multiple ankle surgeries, on both ankles. He's had some knee issues in the past. He's had some meniscus damage, I believe, on his left side. For him, though, he's been he always experiences hamstring pulls on his left. And so when we're looking at this, we have kind of three key things that we're considering that we found in our evaluation. And number one, typically with an evaluation, we're going to do a movement screen where we watch the person move. Okay, so this is just number one. We look for just sort of weak links to see where they fall apart. Number two, we're going to do orthopedic testing to see, okay, does this person have the passive range of motion necessary to get to where they need to go? And then number three, we're also going to do muscle testing to show us, does the person have the right muscles firing at the right times? And really all of these things are going to lead us to corrective strategies. Is it a mobility problem? Do we need to get this person greater range of motion? Or is it a stability problem in which we need to give this person greater range of motion or greater control over ranges of motion, or making sure that the right muscles are firing at the right time? In Mike's case, his hamstring, we tested on his left side. It tested out weak, okay? Really, we tested his medial, his lateral, and everything. It all tested out weak. And what we found is that, number one, big discrepancy between the other side and that side. So that number one, that's going to be one of the big players in our injury risk right there. It's just one side is different than the other. But number two, we found an overactive adductor that was substituting for the hamstring. Okay, and that's significant because we could strengthen the hamstring, but if the adductor is absorbing or doing a lot of that work, we're not going to get as nearly as good of a result from that. So the first thing that we wanted to do is release the adductor on that side. Okay, and oftentimes when we release the muscle that is facilitated, the other muscle that is not, or the other muscle that is being weakened or just seems weak, will almost immediately turn back on to a greater degree, test stronger, and that's going to aid us in our strengthening process. So that was thing one, okay? And that was a significant find because that was on his left side where he's complaining of hamstring strains. Number two is a bilateral anterior pelvic tilt, okay? So for him, if I have my pelvis, and my pelvis is, and I'll kind of turn the camera around here so you can see me a little bit better. If the camera is, I'm sorry, I guess I can't do that. But anyway, if my pelvis is tilted, okay, and I'll actually show you on me. So if my pelvis is tilted up, okay, it's anteriorly tilted, that's going to pull up on my hamstrings and it's going to stretch them. So anytime that I'm going to run or cut or whatever, I have a greater range of motion that my hamstrings have to travel over, and it stretches them further. So it's kind of like stretching a rubber band from the, if the rubber band has optimal range of motion, when I, pull it back and I let go, it's going to produce, a good amount of force. But if it's already stretched out and I stretch it further, that's going to create some rips and tears in the rubber band. That's going to create some problems. So for Mike, he's already in this anterior tilt, not necessarily the best place to be. Number three, and I'll show you here, Mike's weight as a result of his anterior tilt, or maybe just the way he stands, was shifted forward into his toes all the time. Okay, and so he's somebody you could look at him and you could say he has tight calves and, you know, he lacks dorsiflexion, meaning the ability to sit back on his heels, and that is true. But a lot of that was due to the fact that his center of gravity was shifted forward. Okay, and really the solution for that, from a training perspective, was to cue him to be more hip dominant, meaning like when he's deadlifting, I'm cueing him to shift his weight to his heels, to where I'm almost falling backwards, as you can see, and then, you know, when I'm deadlifting, really be as far back as I possibly can to sort of teach the body to shift back. Okay, and again, with him, you know, as we'll show in our performance training, we do a lot more hip dominant work to help to reinforce that. But between those three things, those are our corrective strategies. The third one can be done through training. The first two we do as prep before he works out. Okay, so if we're looking at releasing the adductor, you know, that's simply taking a ball, finding a spot that is sore, just kind of working on it. All right, so that was thing one. Okay, thing two, we just facilitate his hamstring. And so with that, he lies on his back. I'll do the other side so you can see me. I cue him to push his foot into the ground first and then pull back. Okay, so I'm pushing down and I'm digging back. And all I'm doing, I'm feeling my hamstring activate here. Okay, and that's what we want. I'm squeezing, again, pushing down and pulling back about 30 times. Again, just to facilitate. We're not necessarily trying to get it stronger with that exercise we would in a training program, but we're just trying to turn the right muscle on so that when he's doing exercise, all of his muscles are contributing equally versus one doing excessive amounts of work. When we talk about anterior tilt, we use a repositioning drill known as a 90-90 hip lift. And with this one, what I'm going to do is I'm just going to come onto the wall here. I'm going to squeeze the ball between my knees, press my back into the ground. I cue him to put his hands on his stomach here. Press my back into the ground, just tip my hips off the ground slightly. You can feel my hamstrings are turning on here. Tighten my abs, just take a deep breath in. I'm blowing out. I'm contracting these two areas, my abs, my hamstrings. And I just do about 4 breaths, come down. And I repeat that 3 to 4 times. Okay, you know, those two things really are his key corrective exercises, and those are the things that are going to shift him back, that are going to turn on the right muscles. So then when we go to train, you know, we're reinforcing those things with good cueing, you know, as well as exercises to support what we're trying to do. Our second video of the week, I'll talk more about is performance-based training.